Hello everyone. Today's video is a Q&A video talking today about different treatments for nasal colonization, home neurofeedback devices, and, oh, there's one more, and a really tough case of mycoplasma. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you wouldn't mind, please taking a quick moment to like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the first question here says, just for context, it was posted on one of my videos called A Very Difficult Case of Sinus Mold Colonization. And so someone posted a comment here, question saying, would it be okay to put colloidal silver or a teaspoon of hydrogen peroxide in a navage? It holds 8 ounces of filtered water to treat horrible sinuses. My sinuses drain down the back of my throat. I get sinus infections often, and also my nose often runs from the top and leaves the top of my nostrils raw. I put raw honey in my nose when that happens, and it does help. So thank you for the question. I hope everything clears up for you quickly. That sounds really, really unpleasant, to say the least. So just kind of, patients ask me this on a semi-regular basis. Can I fill my neti pot or my nasal rinse or whatever with X, Y, or Z antimicrobial? And when I, think about that, I think to myself, well, what's going to happen to the concentration of that antimicrobial substance when we put that in a fairly large volume of fluid? So if we're going to say take, 8 ounces of fluid, aka 250 milliliters of fluid, and then we take our drops of, frankincense essential oil, our colloidal silver, our silver hydrosol, our grapefruit seed extract, our xylitol, like whatever it is that we're using, when we put it in there, it's really going to dilute it down a lot. Versus if we have a little, nasal spray bottle with saline, we add our, essential oils to that, or we're using just like a straight, silver hydrosol or colloidal silver nasal spray. It's like, we want to make sure it's, in my opinion, with my patients, I say, like, we want to make sure it's not too diluted. If it's too diluted, then we're just not going to get that high enough concentration to actually have that killing effect. I guess, putting it another way, if someone, like, say they had a cut and that cut was, full of dirt, and you happen to know that dirt, well, of course, all dirt has, a bunch of bacteria in it, a bunch of microbes. So you've got this dirty cut. You're like, okay, I'm going to take some some iodine, or I'm going to take some hydrogen peroxide, or I'm going to take some alcohol, and I'm going to, wash that cut out, wipe that cut down to like get that sterilizing effect or that, antimicrobial effect. Well, you would, take your wipe that has, the iodine on it, or the alcohol, or whatever it is that you're going to use, the chlorhexidine, like whatever it is, and then you put it on the cut and wipe it, and there's your like high concentration antimicrobial. Well, if somebody said, well, why don't you take that wipe, put it in a glass of water, stir it around a bit, and then just like pour that water over top of that cut. It's like, it's just going to be, it's not going to work. In all likelihood, not work nearly as well, because it's this much more diluted solution that's just making kind of like very passive, very short-term contact with the surface there. What we really want, in my opinion, with my patients at least, is have like a good, strong concentration of our killing solution, making good contact with the areas where the colonization has happened, i.e., the walls of the sinuses. So I for my patients, I don't recommend using like antimicrobials in a navage or neti pot or whatever you want to call it, because of that reason. So hopefully that information is clear. And that being said, if you've used a navage with X, Y, or Z substance in it, it's been very helpful for you, please post in the comment section. Love to hear about it. When someone's, say, using a neti pot or a navage with some sodium bicarbonate or just a salt solution, that can be really helpful. That can be really great for just kind of like washing things out, kind of like having that sort of like tissue kind of healing effect, or that tissue like calming effect, can be really, really helpful. Can't think of a good analogy off the top of my head for that one. I guess it would be, if somebody had a burn, they burn their arm, it's like, oh, it's going to feel good to pour, cool water over top of that burn. And so in that case, like, perfect. It wouldn't be as good to take, I suppose, like I don't know, if you took all the coldness of that, cold water, and then put it into like, a little tiny square of metal or something, and just like put it on one little chunk of the skin, that's not going to work nearly as well. So it really just depends on what we're actually treating and working on. So like a navage could be really helpful for, say, allergic rhinitis or certain other conditions. But when we're looking at antimicrobials, I think the concentration is really, really important. I'm going to check my time here. Okay. So next one is, oops. Oh, right. So someone had posted a question saying, do you think that tools like Sense AI or other headbands can help with nervous system regulation? So, there's other brands out there. I'm not familiar with Sense AI. I'm actually not overly familiar with the different home units. One of my friends has a Muse. I've heard of the Mind Lift. There's various devices that are out there nowadays, and I think it's wonderful to have them. Honestly, I don't really know how well they work. I really haven't had many patients who have used these home devices and reported to me as how well they work. So if you yourself have used them or know somebody who's used them and yes, it helped, no, it didn't, please consider posting in the comment section. Let us know about that. What I can say though, having looked at my friend's device and being loosely familiar with some of the other options that are out there, is my understanding is they're quite limited from the point of view that you can only work on certain areas of the brain while using these. Like the sensors are only available in certain places. When we're doing in-office neurofeedback, we have the luxury of putting those sensors anywhere that we want on the patient's head. Also, the different programs that are available, the question would be like, to what extent can they be tailored to the individual in question? When we do a brain map on someone, we see exactly what's going on with their brainwave balances or imbalances, then we can tailor the program the neurofeedback program to exactly what we want to work on. There are certain stock protocols or programs when it comes to neurofeedback that have been shown in research studies to be very beneficial for a wide variety of different conditions. So the stock programs that are likely a feature of most of these home units, I think can provide a lot of benefit potentially. I just don't know how they really stack up compared to like an in-home neurofeedback. So yeah, again, interested to hear for folks' comments on that, but just haven't encountered a whole lot of that in clinical practice so far. And then the last one here, so I posted a video a year ago called Mycoplasma, IgG positive, no symptoms, ellipsis, no issue, question mark. So someone posted a question saying here, I'm going to condense it down a bit because it's a little bit long, but it says here, I've looked all over the internet for someone with my symptoms, can't seem to find anybody except for one person. I had Mycoplasma pneumonia, 4 boxes of antibiotics, various possible types. While using doxycycline, I got crazy pain on the left side of my chest, which got better with the start of magnesium after the last antibiotic and using asthma throat spray. But still, for about 3 months since I started the infection, it still has a high temperature. Also, taking lots of supplements, not really helping. Struggling with focusing their vision. The temperature is still quite high. Have these strange waves that come over me, feeling really weak, feeling tired. They last about an hour. Next hour, I'm better. Just feeling the high temperature, then it comes on again. Doctor doesn't know what to do, and wondering what the heck they can do about it. So yeah, I'm sorry to hear you're going through this. It sounds really, really rough, and Mycoplasma can be a real bear to treat, unfortunately. Generally speaking, and again, not giving any advice over social media here, but just if I have patients in my practice who have these like recurring fevers, I'm thinking usually of a couple of things. One is that possible that they might have some like relapsing fever, tick-borne illness. So like there could be like say a type of borreliosis that might be contributing to that, for example, or is it that there's just still a persisting infection? Not a lot of things cause elevated body temperature outside of infection. Antibiotics are great. There's lots. The doxycycline is generally very effective at treating Mycoplasma, but it's not perfect for everyone. Also, sometimes there are co-infections that come along with Mycoplasma. So, generally speaking, in my patients, if they have recurring fevers, I'm usually thinking there's some treatment or there's some infection rather that has not been addressed. In those types of cases, I'd have less confidence that just vitamin and mineral supplementation would help them get better, because at the end of the day, some of these infections are really nasty and we really need those antimicrobials to really kind of seal the deal, so to speak, to get rid of those microbes. Thank you for the questions as always. If you have any others, just post in the comment section below and I'll do my best to answer as soon as I can.